Well, the basic definition of vascular interventional radiology is you're treating disease with image-guided procedures, typically percutaneous, meaning through the skin, where you're threading a catheter into a blood vessel. The fundamental things we do are either open up blood vessels or close them down. So for, say, peripheral arterial disease, you're threading a catheter through a blocked artery and opening it up by doing either an atherectomy or balloon angioplasty and placing a stent. Or, say, central venous obstruction, you're threading a catheter through a blocked vein and opening up and putting a stent in place. The other type of procedures we do are embolization procedures. Embolization is a big word. All it means is you're shutting the blood flow down to something. So the biggest ones we do, the most common ones we do, uterine fibroid embolization. Fibroids are vascular tumors of the uterus. We basically thread a very tiny catheter through an artery in the body, find the uterine arteries, and inject these little tiny particles into the uterine arteries that float downstream and permanently block all the blood flow. The fibroids shrivel up. Typically symptoms are gone in 2 to 3 months without having to have surgery. And women get pregnant after the procedure as well, although we ask them to wait a few months. And then prostate artery embolization is very similar in the fact that the prostate is enlarged. We're talking about benign prostate hypertrophy or hyperplasia, not prostate cancer, but benign prostatic enlargement. The enlarged prostate will pinch the urethra and make it very difficult for men to urinate. We thread a very tiny catheter and find the prostate arteries and inject these little tiny particles that shut the blood flow down the prostate so it shrivels up and the urinary stream returns to normal. And the other broad category of embolization procedure we do is now musculoskeletal embolization, which the knee for genicular artery embolization, the elbow for either golf or tennis elbow embolization, the plantar fascia embolization, and then even shoulder as well. What happens there is you get a tendinopathy where you get a lot of inflammation and abnormal hypervascularity in these areas of pain, like the plantar fascia, for example, is a very thick cord of connective tissue that connects to the heel bone or heel spur. You do an angiogram, you see that light up like a Christmas tree with a lot of hypervascular blush that shouldn't be there. We thread a microcatheter into the area, inject these little tiny temporary embolic particles that shut the blood flow, reduce the inflammation, and typically pain is gone in a week. And people get up off the table and they go to work the next day.